Sex after 60 can be amazing. How do I know? Well, my patients often tell me. And what they tell me is that as they've gotten older in terms of intimacy, many things have gotten better or are great. Let's put it that way. Number one, you got some time on your hands. Not it always helps when it comes to intimacy, having time on your hands. Also, there aren't the pregnancy scares or concerns that maybe people might have had when they were younger. Also, there's a level of experience, right? I mean, there's just more time under your belt, so you've probably had more experiences, or maybe more time with your partner, which also helps to sort of bridge that intimacy bond. And then I've had a lot of patients tell me that they simply feel more comfortable in their skin. They feel more comfortable as individuals and as adults. And sex after 60 can be amazing. By the way, I want to know what you think and what your thoughts are. Now, there can be challenges to sex after 60, though. Let's first start talking about hormone levels, right? Decreased estrogen and progesterone levels, decreased testosterone levels. What does this mean for people? Well, some of my women patients, female patients, say that they have vaginal dryness, for example, or sex may be more painful or uncomfortable than it used to be, in part due to dryness or other things. They may say, women and men, that they have decreased libido or decreased interest. For my men patients, male patients, some talk about erectile dysfunction. And these are things that can happen as we get older, but also as we have other medical conditions, maybe on medications, etc. You know, as we talk about some of the things that can make sex after 60 a challenge and things that can make it better, if you are experiencing any of those things, the vaginal dryness, vaginal issues, issues with sex itself, or erectile dysfunction, talk with your doctor, because sometimes there are either prescriptions we can write that will help you. There may be underlying conditions we need to uncover to figure out why you're feeling that way. There also may be medications, other medications you're on that could actually be causing some of these symptoms that you're experiencing. There are some medications that can decrease someone's libido, like as a side effect, right? So you want to know if those things are going on. Other things that can be challenges. I've had some patients tell me that their arthritis gets in the way. You know, as we get older, arthritis may be something that actually impedes intimacy in certain ways. This is another thing to understand, that if you are in this category, you're not alone. Physical sort of limitations are very real, and it's not necessarily just due to arthritis. There can be other reasons why you have physical limitations. But this is also something you should talk with your doctor about, because my point simply is intimacy is very, very important in adulthood, and with relationships, it's very, very important. And it's something that should not be written off. It's not something that we should be discounting or disregarding or assuming is not important, because that's not the case. Another thing that sometimes can get in the way is sometimes how we feel. I've had patients that say, you know, look, after my husband died, I hadn't been with anyone in a long time. I haven't been with anyone in so long. Like, I mean, what am I, is it going to, will it work? Is it gonna be okay? There often can be anxiety about being intimate if you have not been intimate in a while. And I also say to that, know that you're not alone if that's how you feel. I've had a lot of patients tell me that it's almost not necessarily a fear of intimacy, but a fear of what they might be like in an intimate situation because they haven't been in a while. You know, my point to this video is to talk about something that we don't always talk about a lot, and that is intimacy and sex after 60. And look, it doesn't even have to be after 60. It could be after 50. I mean, you name it. The idea is this is very important. Don't blow it off or discount it or assume that you're not worthy or don't deserve intimacy or a positive intimacy experience with your partner. Now, talking to your doctor is going to be very important for the reasons that I mentioned, okay? But also remember that there are other resources that can help. In addition to prescription medications, you know, investigating underlying issues, looking to see if there are medication interactions or medication side effects. There are sometimes over-the-counter devices, products, etc., that we can recommend. There is therapy and counseling. There are sex therapists. There are a number of things and resources out there that may be able to help you and your partner sort of achieve your goals. And another thing to keep in mind, guys, is as we go about our lives and be intimate with others, it's always important to remember safe sex. Safe sex is very important, and it applies to us in our 50s, 60s, above, 40s, etc., and all ages. So make sure that you are using safe sex practices. Guys, intimacy, companionship, sex is important. And who am I talking about? I'm talking about, of course, adults. I'm talking about consensual relationships, adult relationships. That's what I'm talking about here. But understand that intimacy, it helps so much. It may actually help lower your blood pressure. It certainly helps mood. It could help decrease stress levels and anxiety levels. There is some physical activity in it, so there's actually some benefits. There's even some suggestion that it may help your immune system. I mean, who knows? The idea, though, is that intimacy is a part of life and something that shouldn't be disregarded. So if you feel like you have some of the concerns that I mentioned or others that I didn't mention, talk with your doctor. That's what we're here for. And there are plenty of amazing specialists who help deal with these issues as well. Urologists, gynecologists, urogynecologists, and more. Sex therapists, pelvic therapists, physical therapists. I mean, oh, the list goes on and on. So let me know what you think. Let me know what's helped you. Let me know what's been positive for you, because that's what this is all about. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel and click the little bell for updates. Also, check out my website, drjencaudle.com, for my free health newsletter and daily health updates. Guys, I'm Dr. Jen. I'll see you soon.